Presiding Officer, there is a muscle memory to these exchanges. Week after week, opposition members ask the government about the crisis in emergency care, and week after week, the government respond by blaming the pandemic. They have doubled down. The Deputy First Minister has doubled down on that today by accusing Anas Sarwar of being in denial. And yet the former outgoing Chief Executive of NHS Scotland said this crisis has been years in the making, but the pandemic has only hastened the date. I want the Deputy First Minister to put himself in the shoes of our hard-working emergency care staff, the call handlers answering repeated calls, asking again and again when the ambulance will come, paramedics who are attending doors knowing that behind that door is somebody who's been waiting in pain for hours on end. That must be absolutely traumatic. I have here a Freedom of Information response. We learned the number of ambulance staff hours lost to mental ill health is now up 300% since 2017. That's 40,000 hours between July and September alone. One paramedic told the Daily Record today, "We feel as if we are failing the public, even though it is not our fault." Presiding Officer, it is not their fault. So can I ask the Deputy First Minister to stop grasping at straws, to stop blaming the pandemic and accept that his government is letting these vital staff down?
Deputy First Minister.
Well, first of all, I value the contribution made by all healthcare staff to our National Health Service in all of its component parts. We recognise the pressure on the well-being of members of staff. That's why we put in place the £12 million investment to make sure that staff well-being was supported and individuals could be enabled to continue their activities. I also have to recognise, as members of staff do, the significant impact that COVID represents on the operation of the National Health Service. And I think anybody that comes to Parliament and seeks to diminish the enormous impact of COVID on our National Health Service is not recognising the reality of the situation we are facing.